And on behalf of all Kenyans, allow me, sir, to thank you, Your Excellency, for your personal devotion and commitment towards ensuring that going forward, each and every Kenyan will be entitled to a quality health care package that is accorded to them as a right, not a matter of privilege. I wish to confirm to you, sir, that towards achieving this goal, technical teams from the Ministry of Health and the national and county governments have had a very successful week at this venue, laying the foundation for the scale-up of the scheme. Yesterday, we had a most useful conversation with county governors, which culminated in the signing of a joint communique to inform our collaboration moving forward as we develop the Intergovernmental Partnership Agreement. As I was reflecting on this day, sir, and its long-term implications on our country, I wouldn't help but find myself, the ICT-turned sort of health man, getting quite excited. But because I'm sure that you delve into the golden nuggets of UHC, let me just focus on the technology significance today, and I'll keep it, sir, very brief. Your Excellency, at our core is the hunger to access healthcare legally, history, and securely. Each one of us has dreamt of the day when we can casually walk into a public hospital, be warmly received and treated, medicated, that is tamper-proof from being a counterfeit that has expired. We have prayed for the day that we will never have to worry about innocently undergoing testing, misdiagnosis, and even profit-making medical surgeries fraudulently designed at the altar of our lives. This has harmed the Kenyan public and its faith in our public health institutions. It's been driven by greed, sir, and characterized and categorized by the loopholes in our health system. Today, with the launch of bioregistration of NHIF, we will be making a milestone leap into eliminating this problem. The use of biometric technology in healthcare will ensure that we authenticate patient identity prior to treatment, and through this simple act alone, we will drastically reduce fraud in health insurance, reduce the cost in maintenance, and importantly, improve the management of treatment. As we advance into digitization of our health sector, it will also prove invaluable in cases where we have patients in remote regions requiring treatment. They can simply upload their latest record instantly, enabling doctors elsewhere to examine them at their location. And with this improved efficiency, we can channel the cost of savings to even more Kenyans who were previously uninsured or underinsured. Your Excellency, today is not a day for us to talk so much. We did that over the last 2 days. But Your Excellency, I want to take this opportunity to also thank the health team that is here. And I would like to request people from the Ministry of Health to please stand up. Watu wa afya, Wizara ya Afya, please give them a lot of applause. Because they have sat days, nights to ensure, please sit down, please, to ensure that we are where we are. I also said yesterday, and I want to close by repeating this, Your Excellency. This is not the end of something. This is the beginning of something. We have a newborn in town, and this newborn will have teething issues. We'll expect some challenges, but unless we begin the journey, we will never overcome challenges because they won't be there. So we need to begin this journey and address the issues as they come. We have agreed with the chair of the Council of Governors, Governor Oparanya, that as these things come, we will also cooperate and coordinate our activities. Also, Your Excellency, we recognize the role that we have attached to the governors and also the CECs for health who are here present, because they have spent 2 days in this institution. And if they are here, I would request the CECs who are here, CECs for health, if there are any who are here, please stand up. Please, let's give them a lot of applause also. because they have really diligently worked with us. And we have adopted a way forward on how we are going to work with them. Your Excellency, you are the foremost committed health worker in this country. And therefore, allow me, sir, if I may, just tell one story and then invite you. On one of the nights, I was having an evening out. At that time, sir, we had not identified the cargo special, which is 1 beer and 2 sausages. So on that, 2 beers and 1 sausage. But Your Excellency, in the course of doing so, I heard policemen talking. And they were talking about you, Your Excellency, how you were at a place called Mukuru Wajenga, Mukuru kwa Ruben, Korogosho, wherever. And I want to tell you people, His Excellency called me that evening, and that's why I'm saying, Your Excellency, you allow me to tell this little secret. He called me that evening at night and says, Mutahi, I am in Mukuru kwa Ruben. And do you know that in this area, in this slum area, there is only 1 little bed with 5 hospitals. We have to do something about this. And because of that conversation, Your Excellency, the next day we met with you, and as we speak today, there are 19 hospitals that are being built in Nairobi City. 2 level 2 and level 3 hospitals in every densely populated area, and another 5 hospitals that we are completing that have not been completed. Mama Lucy Hospital, we are completing Korogosho Hospital, and all the other hospitals, Your Excellency, that you directed. And I want to thank you, because it is that commitment, is your personal involvement and personal commitment that is changing the face of health in this country. Your Excellency, after that retro story, can I take this opportunity and ask you, our good friends, to rise up and welcome His Excellency. Karibu sana, Your Excellency. Welcome.
Asante Mutahi, please be seated. Thank you very much. Good afternoon, everybody. So the Chair of the Council of Governors, Governor Wycliffe Oparanya, our host Governor, Governor Ali Hassan Joho, all governors in attendance, cabinet secretaries, principal secretaries, representatives of our development partners, all invited guests. Let me say how happy I am to join you at this occasion of the launch of the biometric registration for universal health coverage, which scheme will be managed under the National Hospital Insurance Fund. Indeed, as Kenya and the world grapple with the challenges arising from the novel COVID-19 disease, today's launch represents a new frontier in our nation's fight against both emerging and long-standing healthcare threats. It is also evidence of the fruitful and dynamic cooperation between our 2 tiers of government, as the national and county governments jointly deliver on the shared mandate for the provision of healthcare services. Ladies and gentlemen, the quest for a healthier Kenya has been a central theme of our social contract and public life since independence. Indeed, our current constitution makes it clear on this matter that every Kenyan has the right to the highest attainable standard of health and the right to healthcare services, including emergency medical treatment. To actualize that promise in our Constitution for better health care services, as a government, we have articulated for implementation specific policy measures in such plans as our National Vision 2030 and the Kenya Health Policy 2014 to 2030, as well as the Big Four agenda. The underlying reason for prioritizing healthcare provision is the recognition of the fact that without improving standards of health, our quest for prosperity and a better life for our people would remain hollow. A healthy population means, other things being equal, higher productivity. On universal health coverage, my goal is to ensure that all persons resident in Kenya have access to the essential health services they need for their health and well-being and at affordable prices. There is no doubt, if we look back to the days we were getting our independence, we can say that we have made significant improvements in our health delivery systems. Equally true, however, access to health care is still a challenge for many, with out-of-pocket expenditures remaining high. Available statistics show that in the year 2018, over 1 million Kenyans were impoverished due to high health expenditures for themselves or for their loved ones. Recognizing these unfortunate circumstances, we as a government have prioritized UHC and developed a comprehensive plan to progressively roll it out and upscale it. We began the UHC journey with a waiver of user fees in lower level facilities, then introduced several government-sponsored insurance programs for the elderly, vulnerable children, people living with severe disability, pregnant women, secondary school learners, among others. We then in Kisumu launched the UHC pilot phase in 4 counties, and today we are launching the biometric registration of the state-funded UHC scheme beneficiaries as we progress further along the path of universal health coverage. Ladies and gentlemen, the UHC pilot phase was by all means a success story. It led to an increase in the utilization of health services with over 1.6 million additional hospital visits made during the 12-month period of the UHC pilot phase. Key achievements of this phase include the establishment of an additional 208 community health units staffed by 7,700 community health workers or health volunteers. And these volunteers attended to over 2 million clients, many of whom were served in their homes rather than having to travel to health centers. Further, there was a recruitment of an additional 752 health workers to narrow existing gaps. Ladies and gentlemen, there were important lessons learned in the process of implementing the UHC pilot phase. Lessons which we need to take into account as we scale up the UHC to cover all counties. I am indeed gratified that you have spent the last few days going through some of these lessons and extrapolating them to find solutions for the way forward. And so I want to assure you that my government, in consultation with all stakeholders, namely the county governments, as well as our development partners, will incorporate lessons garnered from the pilot phase, as well as international best practice, into the preparations for the national scale-up of UHC. Ladies and gentlemen, over the last 2 years, our focus has been on financing health inputs and making strategic investments in areas such as primary health care, community health services, essential medicines and medical supplies, as well as human resources to ensure high-quality health service delivery. In scaling up the implementation of UHC, we will focus on 5 major pillars. The first is what we are here to witness today, which is to scale up the reforms at NHIF, which shall be comprehensive and fully implemented to ensure that the country has a national social health insurer that is able to responsively meet the needs of Kenyans by strategically purchasing services for their health and well-being. So in this regard, today, I direct the Ministry of Health and the Attorney General to fast-track the necessary legislation that will codify these reforms into law and foster the sustainability of the fund. The second is to establish a mandatory UHC scheme which will be managed by NHIF and regulated by the Ministry of Health. And it will act as a national scheme for all persons resident in Kenya, notwithstanding one's social status. 3, adopt the Essential Health Benefits Package, which is already completed and which will enable Kenyans gain access to an essential set of health services at a much lower cost. The package covers several areas, including outpatient and inpatient services, communicable and non-communicable disease management, maternity, dialysis, radiology, minor and major surgery, substance abuse, rehabilitation, emergency services, and cancer treatment, as well as ensuring that we take care of the mental health of our people. These, among others, and we want this provided at the low cost of Kenya shillings 6,000 per household per annum. 4, in line with the clarion call of leaving no one behind, the government will provide health insurance cover to initially 1 million households who are vulnerable and unable to meet even that low-cost premium of 6,000. The identification of these 1 million households by the Ministry of Health, Ministry of Labor and Social Protection, as well as our county governments, is set to begin in a few days across the entire country. 5th, the biometric registration of the identified poor households, which we launched today, is set to ensure that beneficiaries are identified when they seek services at the healthcare facility and at NHIF branches countrywide, and an e-claim system will be used to improve efficiency and to curb fraud and abuse, challenges which we must address as we scale up. Past initiatives to improve healthcare service delivery have not been a success because of these challenges. Ladies and gentlemen, delivering UHC requires close collaboration and synergy within government, both tiers of government. It will also require greater cooperation with the private sector, our development partners, participation of the religious sector, civil society, healthcare practitioners, and support from the people of Kenya at the individual, family, community, and national levels. Indeed, as has been identified in the Building Bridges initiative, Kenyans are eager for improvement in healthcare delivery by both government and private providers. The BBI implementation report proposes fundamental and innovative solutions to the health quagmire that Kenya has faced since the beginning of our nationhood. As a government, leaders and partners in delivering the Kenyan dream, we are called upon to do all that is required of us so that Kenya can indeed be that healthy nation that we seek. The Kenya we want is one in which no Kenyan should leave the country so as to receive the medical care they require. A Kenya that is a world-renowned medical tourism destination whose healthcare bills no longer destroy in a single swoop wealth that has taken decades to create, and a Kenya where every person, regardless of their financial status, will receive the care they need at an institution within the local area, and a Kenya where UHC has become a platform for innovation in developing locally manufactured medicines and equipment. I want to thank, through you, Chair, the county governments. I want to thank our development partners. I want to thank the Ministry of Health, and indeed all other ministry departments and agencies involved in this noble national task for delivering this initiative on time and indeed under budget. In order to secure sustainability of financing for health, I want to urge both levels of government, as has been stated by Governor Oparanya, to ring-fence health sector funds to support the attainment of universal health coverage. I invite all Kenyans and all persons resident in Kenya to register for NHIF and to ensure that they remain up to date with their subscriptions. This will ensure that the fund has the necessary financial depth required to deliver on its very important mandate, in addition to ensuring that in the event of a medical emergency, the fund is able to step in and cover the paid-up member or their beneficiaries. As I conclude my remarks, ladies and gentlemen, I want to make it clear the scheme we are launching today must be a success. In this context, I urge the NHIF to ensure that the precious funds committed to its custody by both subscribers and supporters are utilized prudently with utmost transparency and accountability. Any person who attempts to defraud the NHIF or abuse its processes will be dealt with accordingly as provided for under our laws. Anyway, that's okay. Finally, it is now my humble duty to declare the biometric registration for the Universal Health Coverage Scheme officially launched. Asante. Ladies and gentlemen, I want to just close by just saying, I know we can do this. I know we have the ability to do this if we just work together. I want to urge, especially our members of parliament, don't delay us by unnecessary debates. We all know where we want to go. What we want now is to begin delivering. We want to begin delivering. Our people deserve it and they want it. And we are asking you to partner with us. This is not the time to show prowess in debate. This is the time to deliver so that our people can get this benefit that we all know has turned many, many households in our country into total destitution because of having to cover their medical bills. We have an opportunity now to fix that once and for all. And I am really calling upon each and every one of you to be active partners in this endeavor so that we can achieve this objective for and on behalf of our people. And those charged with the responsibility of looking after these funds, I want to promise you, that if you do not handle these funds with the care and caution that it requires, some of us will go to very extreme lengths to ensure that you shall regret it for the rest of your lives. Let us be clear that we can no longer afford gameplay in this sector. We have a chance. You have heard what Governor Hassan Joho has said here about what he has managed to achieve in just that short space of time, that is saving lives. This is where we want to go. We want to ring fence this money. We want to ensure, just as we have done in education, we want to do the same in health. That the same manner we ring fence our education funds, we should now begin to ring fence our health funds and deliver for our people. Jameni, tufanye hii kazi. Hakuna kitu ingine, na itakuwa furaha sio wako wake, hata kwa macho ya Mwenyezi Mungu atasema kweli hawa wamefanya kazi. Mungu awabariki na awalinde. Asanteni sana.
Asante sana. Niombe sote tusimame kwa wimbo wa taifa.
Beat sensitivity pain fast with Sensodyne Rapid Action for clinically proven relief in 60 seconds.
Daniel is among the over 3,000 farmers in Mwingi Central that have benefited from the smart water capture technology. This project was introduced here by ADRA Kenya, a non-governmental organization that is changing the lives of the people so profoundly, enabling them to help themselves and create a positive change around them.
We have a number of water-saving technologies that we are promoting and that the farmers are supposed to replicate at their household level.
We are Nation, Africa's independent media brand. We are committed to empowering all Africans, from the young to the old, from the curious to the educated, and from the heart of the cities to the rural areas. We are nation. Join us, because if you want to get far, you do it together. Nation. Empower Africa.
Modernization and expansion of the Nairobi commuter rail service is underway.
This platform enables you to come in quickly and to exit out quickly.
The project aims at providing passengers with safe, reliable and affordable transport services in and around Nairobi City.
It will be a big change in the next few weeks.
Progress on the Nairobi commuter rail service project this Sunday at 10 p.m.
Oye, ango ni papa Charles baba wana nimejitwanga quarantine nikiwa na bibi na watoto ndani ya kesi yake. Kitoko tu tunalamba unga hapa tukirarua uji na mboka ninzike. Sasa shida ango ni kwamba last born rangu hamusambati. Hamelamba hand sanitizer yote bwana. Yote. Ati kwa sababu inakaa kama yogurt. Kwa kama ya findu vikholanga without your knowledge. Na ni juice tu pia hamekula sapuni ati kwa sababu.
To get last born by audio motivation, dial star 811*929#. Skiza, non-nation.
Love garlic in your food but hate the hustle of making it? Introducing Fresh Fried Garlic, specially crafted with garlic oil for healthy living. The oil has a beautiful garlic aroma and adds an extra kick when used on your favorite meals. Fresh Fried Garlic combines wonderfully on salads, stir fries, marination for meat, or simply when sprinkled on your favorite dish. Try Fresh Fried Garlic today. Available in all leading outlets countrywide.
That's when she replied, "Give me one good reason to stay with you." Nikamtumia 100 reasons to be my boo. Akanisho unabonga sana kwa text lakini in real life when I'm timid. Hapo nika get minutes ya kupaint picture vivid. Akasema ati I'm in demand. Unadhani DM yangu ni MD? Kumbe nilikuwa nishasotiwa na 100 MB.
Call, SMS and browse from only 10 shillings with Telkom. Now that's power. Telkom, moving with you.
Africanacity is Paul Kihuha turning scrap metal into affordable film equipment. At ABSA, we love Africanacity.